I first started having problems with my airways when I was a teenager, and it manifested as a kind of a runny nose. You know, nothing at the time, nothing really serious, just a little bit annoying. And then as I got older, it got worse and worse, and then it progressed into kind of stuffed up nose. I thought I had a cold, and then I would get chronic sinus infections, and then it just went from there, and it got worse and worse. And then I was finally diagnosed about 10 years ago. So it's been more than 30 years that in total, that I had these issues. You know, throughout this journey, I would say the best strategy of treatment that worked for me was when I finally got onto a biologic. Before that, I had done pretty well everything that the medical care providers recommended, including saline rinses, inhaled steroids. For short stints of time, I would go on an oral steroid, maybe twice a year, 1 week at a time, twice a year. I did that. I've had 2 sinus surgeries. So I've been down the road, I've taken everything. And then it wasn't until about 5 years ago that I wound up taking a biologic called Dupixent. And that within a couple of weeks, it cleared up all of my symptoms. And I've been stable since then. When you first get the diagnosis, it can be very complicated and very confusing in knowing what to do. But fortunately, there is a protocol and a pathway now that your medical care provider should know about in how to deal with this issue. And I expect that they will suggest a similar pathway, probably starting with inhaled steroids or steroids that you spray into your nose. And if you're fortunate, this may control your symptoms. If it doesn't, then you may be escalated to something else, including possibly your doctor may say that you need sinus surgery. And for some people, sinus surgery works well, permanently. For some people, it works for a short amount of time, and then their nasal polyps and all their symptoms come back. But along the pathway following surgery, you can also get now biologics, and biologics have worked wonders. They worked well for me. They may possibly work well for them as well. Another thing to do in terms of managing symptoms is to remember that it's important for patients like us to take care of our health, and especially taking care of your stress level and your mental health, and making an effort to doing that. You know, I try to ensure my own mental well-being by learning how to do meditation, and I saw a therapist to learn cognitive behavioral therapy. But I have to say, it was a difficult thing to do because when my symptoms were at their worst, I was having trouble breathing, and it triggered panic attacks. And when you're having panic attacks, you can't do anything. At that point, you're not in a position to control your psychology. You know, meditation doesn't work if you're having a panic attack. So what I wish I had done was I wish I had learned those strategies before I needed to learn them.